Hi, my name is Emily, and I'll be your registered nurse today. I will first assess the provider order. It says you will be receiving an intermittent catheter, and we will be taking a urine sample from you. Do you have any known allergies? No? Okay, great. So the first thing I'm going to do is wash my hands. And I'm going to check the expiration date on my catheter tray. Perfect, so that looks good. Let me just pull the curtain to assure you have some privacy today. And what's your name? Great, and your date of birth? Perfect. So today you're going to be receiving an intermittent catheter. It is when I insert a tube into your urinary meatus, which is located inside your vagina. You may experience some feelings such as discomfort or pressure, but you shouldn't feel any pain. If you do feel pain, please let me know. All right, so before we get started, I'm going to position you in the supine position with your knees flexed and your feet flat on the bed. We call this the dorsal recumbent position, so you're going to relax your thighs and turn them outward, all right? Let me get on my non-sterile gloves, and we're just going to clean your area quick. I'm going to use a washcloth and my peri-wash, and then we're going to let you dry. So I have a washcloth and I have my peri-wash. I'm going to clean the outside farthest from me. And the other side. Good, so we're going to let that dry. While that's drying, I'm going to take off my non-sterile gloves. And I'm going to open up the sterile catheter box. All right, so we're going to open up the sterile catheter box. Just opening it just like this, and this is going to be my new sterile field. I'm going to put on my sterile gloves. I'm going to grab them and open them up. Remove all of this and open this. I'm going to discard over here. I'm going to open up my sterile gloves. Open up from the corners. Nice and long. This is also going to be sterile inside my gloves. So I'm going to put on my first one. Only touching the outside, we're going to get my fingers in. And once I have pulled it over, good. I can grab my other one with my sterile hand. Put my other hand in. This hand is sterile, so I can help get my other hand in. I'm going to pull it down and pull it down. So now I have my sterile gloves on. I'm going to open up my catheter kit. I have a sterile drape, which is going to be placed underneath my patient with the plastic side up. And we're going to have her lift up her buttocks and place it right underneath. So this is completely sterile. So the sterile pad is underneath my patient. I'm going to use my right hand only because I am a lefty. I'm going to open up my betadine, and I'm going to discard. I'm going to have them placed and ready to use. And I'm going to open up my catheter. I'm going to use the end of the catheter and put the lubricant on it. I'm going to douse the top in lube. Okay, so this is all prepared for us. I'm going to discard the lubricant. So now with my right hand, which I said was my non-dominant, I'm going to spread the labia as much as so I can see. I'm going to use the betadine wipes. The first part I'm going to swab is the side furthest away from me, and I'm going to go from top to bottom and discard the swab. The second swab is going to be closest to me, again from top to bottom, and I'm going to discard the swab. And the last one is going to go directly through the middle from top to bottom, and I'm going to discard the swab. Okay, so now the next thing that I'm going to do is grab the catheter, holding it no more than 2 to 3 inches from the tip, and I'm going to bring the urine holder closer to me so that the end of the catheter remains inside this bucket. I'm going to stick it straight into the urinary meatus. I'm going to hold it there until I see urine. And I'm going to let the urine flow. I'm going to ask you to bear down. Are you in any pain? No. Great. So the urine is now coming, so I'm just waiting for it to stop flowing. Great. Okay, so it stopped flowing. I have received all the urine in the bucket. I'm going to pull it straight out. And I'm going to discard that into my trash. I'm going to move my urine bucket away so we don't spill any. The next thing I'm going to do is use my sterile drape just to dry you quickly. Perfect. All right, so now I'm just going to discard of everything. I'm going to take off my sterile gloves. We're going to roll it up in all of this. And discard my gloves. Discard all of this into the garbage. And I'm just going to don non-sterile gloves one more time, and I'm going to clean you off with a washcloth just to dry you. Great. And I'm going to place you back into your most comfortable position with the call bell in place. And I'm going to cover you back up for privacy. Assure that my curtain was closed. And remove my gloves. I'm going to wash my hands. All right. Do you need anything else from me? Awesome. So I'm just going to document my procedure in the appropriate area. And then we are all done. That is a female intermittent catheter. That's it.